I didn't know about it for years. We probably had it more in my teens and earlier than my teens, but the first times I'd notice it is when I was in the hospital for something else because I'd be monitored. And, someone would come in and saying she's seizing, and then they'd think, oh, it was a drug reaction, or it was from a fever, or it was from something else. And my dad, being a physician, was usually there and would witness it. So they would, put me on Dilantin for a little while, doing, an EEG, and say, oh, well, everything seems okay. It must have been this. And since they were nocturnal and I was at that most of the time living alone, when I got older, until I started getting injured, we really didn't know it was as bad as it was. And it did go away for a while, and then it came back a lot worse. It got to the point where I was pretty much, I wouldn't say daily, but clustering quite often. I do take 4 AEDs as it is. We never tried stopping them or changing the doses because I was doing so well, and the side effects pretty much disappeared on MAD for me, and I'm fortunate with that, really fortunate. And I take high doses of most of the medications. I take Fycompa, Onfi, Zonisamide, and Lamictal XR. We have had to change dosages on MAD. And that's one thing I really try to emphasize in groups to people when they're not seeing doctors and trying to do it on their own, is a lot of times it does affect your drug levels, and the drugs need to be changed. And without those tweaks, that was, the very beginning. I did start with the clinic, and I went every 3 months. And the nice thing is I can still talk to them every day if I need to on our portal. But right now I'm at like once a year, and I'm pretty much figured what works for me. I don't do traditional MAD. I've sort of modified it for what works for me. You modify it for your needs. And, and people don't really get, oh, as long as I say under 15 carbs, whatever, it works for me. It's, it might be 20 carbs for you, or it might be 30 carbs and more fat, or it might be that you're restricted to less carb. You have to play around quite a bit in the beginning to find really what works for you.
Yeah.
And over time it can change. But I think if people get discouraged in the beginning and just don't realize how it doesn't change overnight for the most part. I mean, sometimes it's not for everyone. But it does take a lot of working closely with your doctors and dietitians. And, at least for me, it took, like I said, we're adding another medication now to help with it. But, with the diet, I have tried getting stricter with it now, but I do best measuring by blood ketones, and that's just over the years what we've figured out worked for me. Definitely be patient and definitely work with the doctor. It doesn't have to be your epilepsy doctor. If they're not supportive, find one who will work with you, or a dietitian, and just make sure you get your labs done. And truthfully, if an epilepsy doctor isn't supportive, I'd say find another epilepsy doctor, is my opinion. There's enough of them out there. It doesn't have to be drastic. That's what's wonderful about MAD, is you can incorporate it. It's fairly easy once you get adapted to it. There's products out there more and more. Everyone will tell you, oh, this doesn't work, that doesn't work, you shouldn't be eating that, you shouldn't be eating this. You don't know what works for you until you try it. Some people can't tolerate sweeteners, some can. Online, there are great support groups, but again, everyone's different, and figure out what works for you. Don't let any one person say this is how you do it, because I can tell you no dietitian or doctor is going to say this is the only way to do it, and that's how you have to do it. It's mad because it can be modified for you. My seizures are frontal lobe, and like I was telling you before, I have behavioral issues when I'm postictal. So that is a lot of the correlation there, is your frontal lobe, controls emotions and behavior and things like that. But we learned I needed, my cognition I knew was affected. I used to be able to read a book in 2-3 days. I hadn't been able to read a book in 10 years. And truthfully, after MAD, I can read a book in a couple days now again. Friends noticed it before I did. They're like, wow, you're making sense. And I'm like, well, wasn't I making sense before? And they're like, no. I wasn't noticing as much of my problems, obviously. But yeah, my friends noticed it almost within a week or so. And I didn't do what I would recommend for most people, but it worked for me because at the time I was living alone, other than these three. I just had to get everything out of my house. I gave away 5 Tupperwares of food. And it was just easier for me to go cold. I stopped sugars at first. And after that, I just said, okay, I'm doing this. And I went strict and did it. Definitely worth trying. You have nothing to lose. That's my favorite. I don't understand why anyone would not want to try it. It's the only kind of medicine you can do for yourself. And I do say it's a medicine because it's not a drug, but it's a therapy, I guess is a better word. But it's something you're doing for yourself. It's a change, but it's not a doctor giving you a drug to swallow. It's not, you still might need medications, but it's something you can actually do to help yourself.